Case study may be true answer exploratory, explanatory, descriptive, false answer prophetic, evaluative. Rational use of drug is essential due to true answer high treatment cost, drug explosion, false answer population explosion, drug administration act, lack of awareness. Recurrent cost includes true answer drug cost, personnel cost, false answer equipment cost, building cost, vehicle cost. Primary health is constrained by true answer inverse care. Primary health care is constrained by true answer dash care, unequal care, fragmented care, fabricated care. False answer inverse care. Primary health care is constrained by true answer dash care, unequal care, fragmented care, fabricated care. False answer inverse care. A case control study is featured by natural exposure, recall, comparison. False answer manipulation, follow up. Outcome of cost effectiveness analysis is quantitative, tangible, variable. False answer monetary equivalent. Outcome of cost effectiveness analysis is true answer quantitative, tangible, variable. False answer monetary equivalent. Determinants of occupational diseases are true answer ecosystem, climate change, tools. False answer task, workplace conflicts. Phases of research process includes inductive phase, deductive phase. False answer design phase, ethical phase, feedback phase. Biological effects of light are true answer degradation of bilirubin, stimulation of melanin synthesis, synthesis of vitamin D in the skin. False answer blurring of vision, visual strain. Measures used as same denominator are true answer IMR, MMR, NMR. False answer still birth rate less than 5 mortality rate. Carcinogenic air pollutants are true answer PAH. False answer carbon monoxide, SO2, dioxin, NO2. Particulate matter is also known as aerosols, is an indicator of air pollution, may be carcinogenic, is respirable dust. 2.5 mu has severe health effect. Silicosis is caused by true answer free silica, silicon oxide. False answer amorphous silica, fibrous silica, crystallite silica. Primary air pollutants include true answer CO, VOC5, NO. False answer H2SO4O3. Occupational safety and health relates with true answer NIOSH, OSHA, ILO. False answer Aegis, NORA. True answer NIOSH, OSHA, ILO. False answer Aegis, NORA. Energy expenditure process in body includes true answer basal metabolic rate, physical activity, thermal effect of food. False answer body mass index, mid upper arm circumference. Bioavailability of drug depends on rate of absorption of a drug, fast pass metabolism of drug, route of administration of a drug. False answer distribution of a drug, excretion of a drug. The stages of adoption are true answer evaluation, trial, adoption. False answer carefulness, training. HDG is backed up by true answer HDG is backed up by true answer 169 টার্গেটস। ফলস আনসার 18টা গোল, 300টা ইন্ডিকেটর, 4টা প্রিন্সিপাল, 7টা কোর এলিমেন্ট। Steps of RCT include true answer drawing protocol, sampling, manipulation. False answer selecting general population, triangulation. Drawing up protocol, selecting reference, experimental population, randomization, manipulation, follow-up, assessment of outcome. Indication of cohort study are to answer good evidence of association, stable cohort, false answer higher incidence is unexposed, rare disease exposure is common. Key messages of Global Health 2035 are true answer fiscal policies, convergent initiatives, impressive returns, false answer evolving technologies, basic health care. Sector-wide approaches in Bangladesh are HPNSDP, HNPSP, HPNSP. False answer HPSS, HPSSP. Community participation is constrained by true answer differing priorities, stakeholder discharge, community motivation. False answer community mobilization, community alliance. Levels of database architecture are true answer conceptual level, internal level, external level. False answer thematic level, logical level. An accident is influenced by true answer vector agent. False answer immunity, late time, communicability. Policy research includes true answer case studies, surveys. False answer field experiments, case report, quality control study. Outcome of experimental study is measured by true answer relative risk, false answer odds ratio, cross product ratio, risk difference. Inbuilt association is done in true answer descriptive cross sectional study, false answer prevalence study, case control study, cohort study, ecological study. A population pyramid could determine true answer population momentum, baby boom, migration, life expectancy, dependency ratio. Cumulative trauma disorders include true answer carpal tunnel syndrome, epicondylitis, false answer bursitis, osteoarthritis, fibrositis. Clinical geriatrics deals with true answer biological study of elderly, promoting geriatric health, psychological study of elderly. False answer disabilities with old people, ethical study of older people. Campaign on rural hygiene took place in true answer Bandung, Alliance of League of Nations. False answer Jakarta, 1936, April 25 to 27. Major movements of public health were in disease control phase, health promotional phase, health promotion, disease control phase, health promotion phase, 1920 to 1960, social engineering phase. False answer revival of medicine phase. Disease control phase, health promotional phase, social engineering phase, health for all phase. 1880 থেকে 2000. A latent variable includes efficiency, skill. False answer IQ, intelligence, knowledge. Parametric tests include true answer T test, Z test. False answer McNemar's test, Sign test, Mann-Whitney test. Disaster risk is proportionate to true answer hazard, vulnerability, false answer capacity, preparedness, exposure. Agenda of health challenge includes true answer emerging agenda, quality agenda, false answer unfinished agenda, equity agenda, cost agenda. Paradigm of health system research includes true answer critical theory, positivism, false answer ground theory, phenomenology, interpretive. Population policy is comprised of true answer rational program measures, targets, false answer census, population projection. Models for evaluation research are scientific experimental model, management oriented model, patient oriented model, anthropological or qualitative model. Health promotion action in Ottawa Charter include true answer create environment for health, reorient health services, develop personnel skill. False answer build healthy health policy, strengthen health action. Modern concepts of disease causation are true answer epidemiological triad, multifactorial causation. False answer concept of contagion, miasmatic theory, supernatural theory. Biological effects of complements are true answer opsonization, chemotaxis, cytolysis. False answer affinity maturation, somatic hypermutation. In secondary immune response, the lay period is typically 3 to 5 days. Immunoglobulin G antibody level persists longer than primary response. No memory cells are developed. False answer the amount of IgM predicted is similar to primary response. The amount of IgG antibody produced is less than primary response. Pillars of hospital infection control are true answer hand washing, isolation of patients, prudent use of antibiotics. False answer contamination of equipment, contamination of environment. 5S Kaizen TQM is suitable for true answer participatory approach, developing ownership. False answer resource rich countries, big investment at a time, addressing only non-health issue. Essential newborn care includes true answer thermal care, cord care, based feeding. False answer vaccination, vitamin A provision. To reduce global NCD burden by 2025, WHO focuses on salt or sodium intake, raised blood pressure, tobacco use. False answer rational use of antimicrobial agent, health promotion. Case control study can estimate to answer attributable risk, cross product ratio, exposure rate. False answer risk ratio, risk difference. The sections of a journal article includes true answer introduction, methods, abstract. False answer justification, literature review. Bias in research can be minimized by proper sample size, pre-testing, matching, binding. False answer judgmental sampling. Qualitative study includes true answer case study, ecological study, interpretive study, phenomenological study, case series study. Major manifestation of rheumatic fever includes true answer chorea, subcutaneous nodule. False answer arthalgia, fever, prolonged PR interval. Important pre-inflammatory cytokines are true answer IL-1, IL-6, TNF, IL. False answer IL-10, transferring growth factor beta. Initiation of breastfeeding is influenced by true answer health of a mother, perception of a mother, perception of mother, fluid intake by a mother, family support, economic condition. Mucormycosis, true answer is caused by saprophytic mold, is also known as black fungus, is caused in patients with reduced host defense, is caused by saprophytic mold, is also known as black fungus. Mucormycosis is caused by saprophytic mold, is also known as black fungus, is caused in patients with reduced host defense. False answer affects only the lungs, is caused in 80% cases by Rhizopas oryzae. High potency vitamin A can be given to true answer children of 1 year, children of 4 year. False answer pregnant woman, newborn baby, lactating mother. 1 serving fruit means 100 gram orange contains 2 gram protein. False answer contains 40 ক্যালোরি, 50 গ্রাম রাইপ ম্যাঙ্গো contain 20 গ্রাম কার্বোহাইড্রেট। Long term effects of low birth weight are true answer chronic dyslipidemia, blindness, intellectual disabilities. False answer diabetes, heart failure. A hospital budget may be true answer stationary budget, category budget, event budget, envelope budget, marginal budget. Healthcare consumption cost includes true answer personnel cost, opportunity cost, personnel cost, opportunity cost, loss of income, unofficial payment, family cost. Criteria of a research includes true answer avoidance of duplication, clear statement of the problem, feasibility, specific plan, applicability. Cluster sampling is featured by true answer selection of clusters by geographical criteria, inclusion of all the members of a cluster, selection of clusters by geographical criteria, inclusions of all the members of a cluster, randomization among the clusters. False answer maximum homogeneity within the clusters, maximum heterogeneity in between the cluster. Ecologically sound waste management includes true answer waste reduction, segregation, composting. False answer gasification, anaerobic incineration. Ionizing radiation includes true answer neutrons, beta particles. False answer phasers, positrons, lasers. Soil is the reservoir of true answer mycetoma, amoebiasis, anthrax, tetanus. False answer cholera. Learning is true answer dynamic, ongoing, continuous, regular. False answer periodic. Group discussion requires true answer more alternatives, more time. False answer more information, more subscription, more acceptance. Harvard referencing is featured by true answer author date system. References are listed in alphabetical order. False answer numeric system. Reference list is in numerical order. In-text citation requires unique number. Vitamin C helps in true answer maturation of collagen tissue, iron absorption, lipid peroxidation. False answer maturation of prothrombin, reduction of serum cholesterol. Zinc true answer helps in reproduction, helps in healing process, helps in growth. False answer increase iron absorption, increase glycoprotein synthesis. Components of good governance includes true answer reducing risk, following international standards, driving quality improvement. Ensuring safety. False answer avoiding public experiences. Components of good governance includes reducing risk, following international standards, driving quality improvement. Ensuring safety. False answer avoiding public experiences. Cellular components of innate immunity are true answer dendrite cells, eosinophil, macrophages, natural killer cell, false answer lymphocytes. Neutrophil, basophil, mast cell, lymphokine. Principles of research ethics are true answer respect, benefit, justice. False answer personality, dignity. Organochlorine compound includes true answer aldrin, linden. False answer malathion, phenethion, decapthon. Causes of neonatal mortality are true answer sepsis, birth injury, false answer malnutrition, prematurity, accident. Purposes of ICD-10 are to answer develop uniform classification of disease, make accurate comparison, facilitate health problems, maximize profit, ensures easy management of healthcare. Pneumoconiosis is a chronic lung disease, occupational fibrotic lung disease, irreversible occupational lung disease, cause of eggshell calcification, manifestation of dust inhalation. Types of epidemic are true answer common source epidemic, propagated epidemic, slow epidemic, false answer sporadic epidemic, sequelae epidemic.